Your kidneys work quietly in the background every single day, filtering waste, balancing fluids, and regulating essential minerals in your blood. Unlike a lot of health problems, kidney damage often doesn't come with obvious symptoms until a significant amount of function has already been lost. This is exactly why doctors describe kidney disease as a silent condition in many cases. By the time symptoms like swelling, fatigue, or changes in urination show up, the kidneys may have already been under strain for years. The good news is that many of the everyday habits linked to kidney strain are also the most modifiable. In this video, we're going to walk through 6 common habits that research and clinical guidance suggest may quietly affect kidney health over time, why they matter, and what doctors generally recommend instead. This isn't about fear or extreme lifestyle changes. It's about understanding your body a little better so you can make informed decisions and know when it's worth talking to a doctor. The first habit worth understanding is chronic dehydration, meaning not drinking enough fluids consistently over time. Your kidneys rely on adequate water intake to filter waste effectively and to produce urine that carries that waste out of the body. When fluid intake is consistently low, urine becomes more concentrated, which can increase the risk of kidney stones and may place additional strain on kidney function over the long term. This doesn't mean you need to force down excessive amounts of water either, since needs vary based on body size, activity level, climate, and overall health. A simple general guide many doctors mention is paying attention to urine color. Pale yellow generally suggests adequate hydration, while consistently dark yellow may be a sign to increase fluid intake. If you have a heart or kidney condition already, fluid needs can be different, so this is worth discussing directly with your doctor rather than following a generic rule. The second habit is regularly consuming high amounts of sodium, most often from processed and packaged foods rather than the salt shaker itself. Excess sodium can cause the body to retain more fluid, which raises blood pressure. Since high blood pressure is one of the leading causes of chronic kidney disease worldwide, a diet that's consistently high in sodium may contribute to long-term strain on the kidneys, particularly in people who are already at risk. The tricky part is that a large majority of sodium in a typical modern diet doesn't come from home cooking. It comes from processed foods, canned soups, deli meats, frozen meals, and restaurant food. Reading nutrition labels and being mindful of sodium content, especially if you already have high blood pressure or a family history of kidney or heart disease, is a habit doctors frequently recommend. The third habit is the overuse of certain pain relievers, specifically a category called NSAIDs, which includes common over-the-counter medications like ibuprofen and naproxen. Occasional use at recommended doses is generally considered safe for most healthy people. However, regular long-term or high-dose use of these medications has been associated with reduced kidney blood flow, and in some cases kidney damage, particularly in people who are older, already have reduced kidney function, are dehydrated, or take these medications alongside certain other drugs. This is not a claim that occasional use of a pain reliever is dangerous. Most people use these medications safely throughout their lives. The concern is specifically around frequent, prolonged use without medical guidance. If you find yourself regularly relying on over-the-counter pain relievers for chronic pain, that's a conversation worth having with your doctor, both to address the underlying pain and to make sure your kidney function is being monitored appropriately. The fourth habit is consistently high sugar intake, particularly from sugary drinks, and its connection to blood sugar control over time. Diabetes is one of the leading causes of chronic kidney disease globally because consistently high blood sugar levels can damage the small blood vessels in the kidneys responsible for filtering blood. This doesn't mean sugar directly damages kidneys in someone with normal blood sugar regulation. The concern is with the long-term pattern, a diet high in added sugars and sugary beverages is a known contributor to insulin resistance and type 2 diabetes, which in turn is a major risk factor for kidney disease. This is a good example of why kidney health can't really be separated from overall metabolic health. They're deeply connected. The fifth habit is smoking. Smoking affects blood vessels throughout the entire body, including the small blood vessels in the kidneys. Research has linked smoking to a faster decline in kidney function over time, and it can also worsen the effects of other risk factors like high blood pressure and diabetes. Smoking is also associated with an increased risk of kidney cancer. For people who already have some degree of kidney impairment, smoking has been shown to accelerate the progression of kidney disease. Quitting smoking is one of the most well-established, evidence-backed steps a person can take to protect not just their kidneys, but their cardiovascular system as a whole. The sixth habit is the excessive or long-term use of certain dietary supplements and herbal products taken without medical guidance. This might sound surprising since supplements are often marketed as universally healthy, but some herbal products in very high doses of certain vitamins and minerals can place strain on the kidneys or interact negatively with kidney function, especially in people who already have some degree of kidney impairment or who take multiple supplements at once without knowing the cumulative effect. This isn't a blanket statement against supplements. Many are safe and beneficial when used appropriately. The concern is specifically about self-prescribing high doses, combining multiple products without professional guidance, or continuing certain supplements long-term without any monitoring. If you take regular supplements, it's worth mentioning all of them to your doctor, including anything you consider natural or herbal, since these are not automatically risk-free. So what can you actually do with this information? The first step is simply awareness. Not everyone needs to overhaul their entire lifestyle, but understanding these 6 areas: hydration, sodium intake, pain reliever use, sugar intake, smoking, and supplement use gives you a practical checklist to reflect on honestly. The second step is knowing your numbers. Routine blood and urine tests, specifically ones that measure kidney function, are a standard part of most annual physicals, and they can catch early changes in kidney function long before any symptoms would appear. If you have risk factors like diabetes, high blood pressure, a family history of kidney disease, or you're over the age of 60, it's worth specifically asking your doctor whether your kidney function has been checked recently. The third step is talking to your doctor about anything on this list that applies to you, rather than making major changes based solely on a video. For example, if you regularly use pain relievers for chronic pain, your doctor can help find a safer long-term approach. If you have high blood pressure, managing it well is one of the most protective things you can do for your kidneys. If you smoke, your doctor can help connect you with resources to quit that go far beyond willpower alone. It's also worth being clear about what this video is not saying. Having 1 or 2 of these habits occasionally does not mean you have kidney disease or that damage is guaranteed. Kidney health is influenced by many factors, including genetics, age, and other underlying health conditions, and these 6 habits are contributing factors that are well documented in medical research, not deterministic causes. The goal here isn't to create anxiety, it's to highlight the areas that are genuinely within your control so you can make informed choices and know what's worth discussing at your next checkup. To bring it all together, your kidneys filter an enormous amount of blood every single day without asking for much in return, but they are affected by long-term patterns in hydration, diet, medication use, smoking, and supplement habits. None of these require perfection. Small, consistent improvements like drinking enough water, being mindful of sodium and added sugar, using pain relievers as directed rather than habitually, avoiding smoking, and being cautious with supplements can meaningfully support kidney health over the years. If anything in this video applies to you, the best next step isn't to panic or make drastic changes overnight. It's to bring it up with your doctor and consider asking for a simple kidney function test at your next visit. Catching changes early gives you and your doctor the most options for protecting your kidney health long-term. Thank you for watching. If you found this helpful, consider subscribing for more evidence-based health breakdowns like this one, and let us know in the comments which habit surprised you the most. This video is for educational purposes only and does not constitute medical advice. Please consult a healthcare professional for concerns about your health.